Sir?
I'm Geoff.
Thank you, Jed.
I'm from southwest Sydney, which the Minister forgot to mention that we've got an upgrade of Campbelltown Hospital. Campbelltown Hospital is involved here today. I'm afraid quite frequently people in Greater West think that the southwest is the same thing. It's not. It's completely different. That's not my question. The previous government, this is to Minister Humphries, the previous government pledged 40 million or thereabouts for mental health at Campbelltown Hospital upgrade, which has not come to pass. I believe the present government has mentioned the figure of 61 million. Is that going to happen, and when? You know, we really need it. We're suffering badly compared with the North Shore and the eastern suburbs. We need it desperately. Simple question. Thank you.
No, thanks, Geoff. And the previous government in the dying days did make a commitment. We've chosen to review that planning based on the fact that the corridor that you're part of, and a number of the members are here this evening, between Wingecarribee down towards Barrel that feed back up into Campbelltown and Camden, all that area, we know what the growth rates are going to be like, and they're going to be quite exponential. Our view was that the previous work was not encompassing all that area, and it was pretty much down the line, as I alluded to before, based on acute inpatient beds. Part of the discussion we're having with the federal government and with the community is looking at how we describe and how we model what is best care. Part of what needs to happen in southwest Sydney off the back of that growth is a more robust planning system put in place to encompass community-based mental health care, subacute health care, of which Liverpool will be a recipient of additional beds there, and inpatient acute beds. So it's certainly in the planning system. I can't give you a time frame, but are we committed to that corridor and Campbelltown becoming a substantial base for mental health care? Yes, we are. We've had a number of conversations through. Brian's done a great job as a local member there, Brian Dorr, with some of the reference groups that have been part of that previous discussion and that are moving in and have been working with that recent planning that was undertaken with Amanda's group on this side as well, and all the health planning and population planning people. So hopefully we'll keep you up to date on that, but we need a broader base plan. We could probably do better, that's what I'm trying to say. Thanks.
Can I just add to that? Yes, it wasn't mentioned, but there is $139 million being earmarked. Work has already started on early works for Campbelltown Hospital redevelopment. I'm very proud of the fact that we've been able to do that. With Brian Doyle here, one of the things that happened in the last days of the last government was they promised a lot of things, but there was no funding provided. So we've had to provide, I'm very proud of the fact that the bulk of our health infrastructure money in metropolitan cities come to Western Sydney, the vast amount of it. But we are also going back to the drawing board, talking to the clinicians and others where we need other services. And it doesn't, because mental health is not in that first tranche, doesn't mean it won't be. It's a work in progress. I don't know if Amanda wants to add to that.
Minister, and thank you, Geoff, for the question. Just to reinforce really clearly, the needs of mental health patients, their families and carers really is a priority for the South Western Sydney Board. It's a very large part of the work that we do, and in providing services in South Western, we work really closely with a whole range of community-based services and non-government agencies, and Geoff, I know that you're aware of that. So for us in South Western, the development of mental health services, the needs of those families and carers is absolutely critical. It's a major part of our clinical services plan going forward, and the board have very clearly identified that as a priority, both in terms of service development and capital needs for the area.